Alright, welcome to the NICUDoc Answers. I'm Dr. Ford, the NICUDoc. So, recently I got a question about vasopressors, and I'm here to answer all your questions. So, let's talk about vasopressors. Giving the trainees all those NICU secrets, teaching the families, bringing you physiology and the latest evidence and management of NICU babies. Just having fun with it. Dopamine is one of the most common vasopressor we use in the NICU. So, vasopressor actually acts on 3 different receptors. When it's low dose, usually 1 to 3, sometimes even up to 5, it actually works on the dopamine receptor. The dopamine receptor is actually helping ultrafiltration of the kidney. What does that mean and how does it work? Well, what it does is that the kidney actually works by having vessels going into it called afferent and vessels coming out called efferent. What the dopamine receptors do is that it actually opens the afferent vessels and then it squeezes or vasoconstricts the efferent. So as you can imagine, if you open the afferent and squeeze the efferent vessels, it causes blood to go into the area of the glomerulus where the nephron is, basically where the blood flow goes into. And because it's squeezing blood flow coming out, it ultrafiltrates. It actually gives more blood flow and then more ultrafiltration, more fluid comes into the kidney, therefore making it kidney safe. And so that's why we use low dose dopamine as a sort of safe fluid ultrafiltrating medication, not so much really for hypotension, for low blood pressure. When you get a little bit higher into medium dose, and that's when you're getting above 5 and usually until about maybe 10 or 12 and really a little bit less than that, then you're getting into beta and beta 1, beta 2s. Beta 1 is the medication really straight for the heart. What it does is that it increases contractility, it makes the heartbeat stronger, and it makes the heartbeat faster, or chronicity. It makes the heartbeat faster, okay? And your beta 2s are the receptors that are around the muscles that surround your bronchioles. Now, these are the ones that help sort of relax the airways. So if you have asthma and they constrict, you give, for example, something like albuterol, and the receptors in these little muscles will go ahead. If you give albuterol, which has a beta 2, once you agonize those, once you actually stimulate those, they will actually relax. Those are the beta 2s. So dopamine in the middle dose, they will actually act on those beta 1, beta 2s, relaxation of the airways, and also contractility and chronicity of the heart. When you get to a higher dose, you get your alphas, and your alpha 1, alpha 2. Your alpha 1 are vasoconstrictors. What this does is that it actually will cause the blood vessel, especially in the periphery, to go ahead and squeeze. When you squeeze, your blood pressure goes up. What it does, though, and you have to be really careful, is that it also increases something called an afterload. What that means is that it makes, when your heart, your left ventricle, for example, is squeezing to try and get blood out of the heart, it makes it harder for you to squeeze because the blood vessels in the periphery, because they're squeezing, it increases that systemic vascular resistance, making it harder for the blood vessel, because the blood pressure is going up, for the blood to come out of the heart. That's increasing afterload, okay? Now, the alpha 2 is more of a central control of blood pressure, okay? So there's a little effect to that. Sometimes actually can cause hypotension. But anyway, it's mostly really acting on your alpha 1. So you have to be really careful how you're regulating that. A second medication that we use is your Dobutamine. Dobutamine has no alpha effect. It has just a beta 1, beta 2, okay? And then the third medication is epinephrine. Epinephrine also has that alpha 1, alpha 2, beta 1, beta 2, just like dopamine. The difference is that it actually is dose dependent on as you increase the dose, it actually works on all receptors equally as you increase the dose. That's very different to dopamine. Dopamine, remember I told you, low dose, dopamine receptor, medium dose, beta receptors, and higher dose alpha. So it depends on the dose. This one in epinephrine, it really works on all of them, but as you increase the dose, it has a stronger effect on all of them together, okay? Now, when you're trying to decide which one do you use out of those three, there's others, so I'll touch on those in a minute. When you're trying to decide which one do you use out of those three, you have to think about what's going on with the baby. If you have heart problems, if the heart is not pumping really well, if you have a lot of pulmonary hypertension, and let's say you have low oxygen, and your heart's not pumping really well, you're gonna be wanting to use something that doesn't use a whole lot of oxygen. You wanna squeeze the heart, you wanna pump that blood out of the heart, but you don't wanna be using a lot of oxygen. And so if you're using something that squeezes the blood vessels, and you're putting a lot of afterload, so we talk about that alpha one. Remember we talked about that alpha one puts a lot of pressure on your heart to try and get blood out. Then you're going to be consuming a lot of oxygen because you got to squeeze even harder to get that blood out of the heart. You have to pump stronger to get blood out of the heart. And so you might not want to have that alpha effect, but you do want to have that beta effect, that beta 1, to squeeze and to be able to pump blood out of the heart, because as I mentioned, that heart is not pumping really well, so you want to increase that contractility. Okay, so you would want to use something like Dobutamine in that case. You've got that beta 1 to be able to squeeze the heart, to be able to help it out, if you will, without having the effect of an increased afterload, which is that vasoconstrictor. However, if you have a baby that has hypotension involved in all of the picture, then you need to get that blood pressure up. You're gonna want to have that alpha effect because you want to get that blood pressure up. And so you choose, Dobutamine won't help you because it won't have that alpha effect. So you'll want to choose something, either you want to choose the Dopamine or you'll want to choose Epinephrine. And that's where you can choose between one or the other. And that sort of depends on you, which one you want to choose, which one you're comfortable with, okay? There's another medication called Vasopressin. And Vasopressin is just that. It goes straight into the blood vessel and presses the vessel. Vasopressin, right? Vasopressin will be a really good one for squeezing the blood vessel. It has no effect on the heart. So if you don't want to be consuming oxygen, as I mentioned, that case where you really don't want to consume oxygen, you don't want to be messing with the heart, you don't want to be increasing the rate of the heart and consuming even more oxygen, but you got to get that blood pressure up, Vasopressin is a really good one. It's a really good medication, for example, for sepsis. You don't want to be using oxygen up because the baby may be already sick. So you would use something like Vasopressin. The thing with Vasopressin is it's also called antidiuretic hormone. And what that is an antidiuretic. It actually holds on to water. It acts on the kidney, specifically on distal convoluted tubule and collecting ducts. And it works on these proteins called aquaporins. And these aquaporins will now send signals to hold on to water. And it's not that bad of a problem to hold on to water. In fact, that's actually part of how it can help secondarily to increase your blood pressure. It holds on to water as well, and therefore increases your blood pressure, aside from the effect of the actual vasoconstriction. But the problem with that is that as you hold on to more water, it drops your sodium. You actually can get hyponatremia, and you can actually drop your sodium dramatically to very dangerous levels. And if you drop too quickly, it can actually cause seizures to babies, to patients. So you have to be very careful, and you have to manage that. You have to follow that sodium in the patient, okay? So that's another medication you have to watch out for. Hydrocortisone, although not a vasopressor, hydrocortisone is used in the NICU. And the reason why it's used is because it actually stimulates or hyperstimulates the receptors. So it does really nothing to the vessels themselves, but it actually makes the receptors more sensitive. So people, what they'll do is that they may add it if you are already on a vasopressor. If you started a vasopressor, you may add the hydrocortisone if you're increasing your doses of that vasopressor, or if you're starting a second vasopressor, because it makes that vasopressor already more sensitive. So if you're increasing doses, you'll be more sensitive to it, and so the body will react better using hydrocortisone, okay? keep in mind it is a steroid. It's a corticosteroid. So you have to be careful how you use it and not to use it in prolonged instances, because it does have different effects, and then you might have to wean it as well if you've been using it for a long time. If you're using it for a long time, make sure you involve an endocrinologist, a hormone specialist, to help you with weaning. Okay, so that's essentially how we sort of decide which medications we use for these situations when you have a sick child and you're trying to decide which vasopressor to use. You sort of deal with, do I want to put too much pressure on the heart? Do I want to go ahead and consume too much oxygen? Which receptor am I going to choose? So think about the receptors for each medication of vasopressor that you're going to be using. And then if you're going to be starting a medication, think about what effect it has to the baby and which labs you have to follow. Specifically, again, vasopressin is the one thing you have to really be careful with. You have to follow always. Make sure you follow that sodium. In any vasopressor you're starting, you're always going to be wanting to follow, obviously, your lactate to make sure that you're not causing any damage to the actual tissues, as you're going to be following this anyway because of the fact that a baby's sick anyway, but you always want to be mindful of that. Okay, that's vasopressin for you. Hopefully I answered that question for you, and please, in the comment section, go ahead and ask the questions that you want me to answer. I'm here for you. So this is the NICUDoc Answers. Go ahead, I'll pick an answer, and next time I'll be answering your question.